Welcome, folks, to our session on Connecting Data to Policy 2020 with a home study, the Pan-Canadian study on youth homelessness. My name is Wendy. I am your moderator this morning, and Mary Jane McKitterick and David French are your speakers this morning. I won't belabor their bios. They are located in Whova. I do invite you to use the Whova chat and the Q&A as we are going through the session. I will be monitoring that and making sure questions are brought to both David and Mary Jane, but also I suspect they will invite you to use your mics as well to have a nice dynamic conversation about what is going to happen. So I will turn it over to David and Mary Jane.
Thank you. David and I want to welcome you and thank you for attending our session on Connecting Data to Policy, Without a Home, the National Youth Survey. Without a Home is a national coalition dedicated to transforming responses to youth homelessness through policy, planning, practice, and innovation. Next slide, please. So this is our presentation. We'll start with, we'll talk a little bit about what is Without a Home. Way too many W's there for me this morning. And then we'll talk a little bit more about the 2019 data story because the first one is coming from 2016. The third part of our talk will be about the policy and practice pathways. So really what we're talking about is how do we use this data and how did it help shift our focus and our work upstream to prevention. And then we have hopefully a long time for Q&A and we'll be able to dig into any of those questions. So Without a Home is the study is with a collaboration between Away Home Canada and the Canadian Observatory on Homelessness. There was generous support from the Home Depot Foundation for this work. And we also want to recognize their ongoing efforts to break down the stigma of youth homelessness. Next slide, please. So what is Without a Home? We'll be discussing two related studies today. The first are the results of the Without a Home study in 2016. And the second is the study from 2019. So the 2019 results are still being analyzed. It was due to be released this year, but it's a bit postponed due to our usual, right, the COVID-19. We will share with you in this discussion some changes in our methodology and some of the early results. But mostly what we want to show you is how we were able to use this data to transform the way we work and how we were able to shift upstream to prevention of youth homelessness and away from that crisis response that we had before. Next slide, please. Thanks, David. So the Without a Home study is, let me just fix my notes here. So what it is a detailed survey that was delivered through youth serving organizations in communities across Canada. There were over 1,100 young people that were surveyed, and these young people took the survey with the service providers who knew them and they trusted. It's the first pan-Canadian study of youth homelessness in Canada. It was across 47 different communities in 10 provinces and territories. It was the very first study on youth homelessness, and it became our baseline data for our work. So interestingly, other communities had been doing local studies on youth homelessness, and our results were very similar. So that was very helpful as well. But what is it? It really allowed us to change our conversation. Now we had actual data that we could use to tell the story of youth homelessness to a broad range of stakeholders, communities, government, and the general public. It was based on evidence. Before that, we had more of a disconnected anecdotal story. Okay, next slide, please. Thank you. So why? Why young people? Why did we do this? The causes and conditions of youth homelessness are very different for young people. And when we talk about young people, we generally mean 14 to 24. And so even within that range, there are a lot of differences across there. But they actually experience homelessness very differently, and we need to provide different solutions and really start to understand that better. So that was the impetus for the study. some of the experience or some of the differences are they lack experiences of living independently. So even simple things like budgeting skills, lack of references for landlords, and even understanding their rights and responsibilities. They also lack a lot of work experience, especially the younger ones. So finding employment that can support them is more challenging. It's no longer the 70s when you could leave school at 16 and potentially find a great job at the local factory and raise a family and buy a house. Employment is very different right now, and especially for young people when they haven't got a foot in the door yet. I think one of the most important one though is the developmental changes. Young people need that extra time and that we all have during adolescence to try to make mistakes, learn and build resilience, just like the rest of their house peers. So that those developmental pieces are really critical to how we understand youth homelessness and what supports we need to put in place for that. They're also extremely vulnerable to criminal exploitation and trafficking, and we'll talk a little bit more about that. David will have more to say about the harm and the vulnerability at this age. So we really need to better understand a young person's pathway into homelessness so we can prevent those youth from becoming adults who experience chronic homelessness tomorrow. And there is more research coming out that links chronic adult homelessness with those early experiences of youth homelessness. Thank you. Next slide. So what are the expected impacts on communities and organizations? So I'm just going to talk a little bit about the community level data and how that works. What happened when we released this information and folks were able to get it at the community level? In order to change those conditions, you really need to change the stories that form the mental models from which we operate. So community level data helps us to tell those important stories to a broader range of stakeholders, as was mentioned earlier, but this can be really helpful at the local level. So first of all, community level data was able to help service providers understand clients' needs better. It was able to support staff and even in terms of the professional development. Of course, program planning and development was enhanced. And also systems planning. So we at Away Home are really supportive of communities and sectors, communities doing community-based systems planning and implementation. So bringing all those stakeholders together to really close the gaps. But I think one that's really important for the communities were the support for local advocacy for policy and funding. So then, again, as I mentioned earlier, they now had data, information, and an ability to tell a story that made it real to funders and government. And then, of course, the public education piece. So we had more data and more information to break down the stigma around youth homelessness locally. Next slide, please. So just to give you a little bit of a snapshot of the 2016 findings, and we'll talk, David will help talk a lot more about this as well. But the most significant findings from 2016, and I think the critical one that was the big shocker for us, was that 40% of the young people who were surveyed had their first experience before the age of 16. And so if you know, because the younger the exposure, the greater the harm, this was quite shocking for us to know that that was happening. We also know that there were, that the experiences of homelessness were overrepresented within minorities. And we'll talk a little bit about that in the next slide. 85%, and this will come, I think, for this conference, 85% experienced mental health problems of the surveyed youth. 55% had involvement, some involvement with child protection services, and 50% were not those young people that were considered not in employment, education, or training. And again, the criminal victimization and sex trafficking, very high rates compared to their peers, their house youth. Excuse me. So the other thing is this group is very challenging to support, and we'll talk a little bit more about the adverse childhood experiences next. But this is where the data began to strongly support the need to the shift to prevention. So suddenly we're really able to say, okay, the further upstream we go, the better our outcomes are going to be. Next slide, please. So just digging into that 2016 data a little bit further, we have a better understanding of the who. So this slide shows a bit more of the diversity of that population. And that was really helpful to communities and policymakers to see this as well. So LGBTQ2S youth were grossly overrepresented in the population of youth experiencing homelessness. We haven't really had good data prior to this on this population, a lot of estimates, but this is giving us a clearer picture that about 1/3 of young people are in this category and ongoing experiencing trans and homophobia is creating a risk for young people. 30% are Indigenous, and this is really important in light of the Truth and Reconciliation 94 calls to action. We want to think differently about how we work with people and how we work with who are Indigenous and how we work with young people as well. So this includes, we have to start, of course, as we've talked about in across this conference and across, we understand this now, we need to include the history of colonialism, racism, and as well deepening our understanding of Indigenous worldviews, treaty and land rights, and local relationships. So we also observed that the percentage was higher further west and north of those young people. So we need to include those local and specific solutions or specific information in our solutions. Also, 28% identifies as part of racialized communities. So that was, of course, stronger in provinces like in Ontario, but this is important in light of the rise of the Black Lives Matter movement and our complexity around how diversity, equity, and inclusion are considered in solutions. So we're doing a lot more digging into what this actually means and what solutions and who we need to partner with to develop those solutions. Okay, I think that's me. David, I think you're up. Thank you.
Yeah, great work. So now we get into the 2019 data story, and it's important for everyone to know that in our work is based on continuous improvement. And so we didn't take the 2016 survey and plunk it into 2019 and suggest that it was going to work just fine. We knew that there was elements of the baseline data we wanted to continue, we wanted to remain the same. But we also recognized through the analysis of the data and the 29.5% that Mary Jane highlighted for young people who identify as LGBTQ2S, we had many professionals tell us that the number is probably higher than that. And so we needed to make adaptations to how we were asking questions to ensure that young people felt comfortable and supported. And also we needed to make adaptations to how we were supporting community organizations to deliver the survey to ensure that young people were safe. So this slide really just shows the variation to which we were asking questions and the degree of which they spoke to not only experiences, but just individual demographic data. And we knew that we needed to compare the research from 2016 to 2019, but we also knew that we wanted to engage young people from across the country with lived experience about how to deliver the survey. So again, not only did the survey change, but how the survey was administered at the community level changed. So much so that actually young people with lived experience who have successfully transitioned out of homelessness came back to those organizations to help administer the survey. That kind of supported some of that street cred that young people need so much within this work. And sorry, I'm presenting. I've got a 6-year-old daughter who's awake. And we also engaged in developing the questions policymakers from across Canada around what were the gaps for them. So they looked at the 2016 data, they've used it. It's been sort of permission giving around thinking differently and innovating within their work, but also if you were to see new results within the 2019 data, what would you want to see? And so in summary, the 2019 data did have a series of more participants as well as more communities. A total of 98 agencies administered the survey, and they did that in a number of different ways. And so it wasn't just a young person sitting in front of a desk and doing it. They did sort of these magnet events and ensured that young people felt comfortable doing it. And also every young person who completed the survey received a stipend for telling their story. We felt like it was a really important and a bit of a privilege to have them tell their story. And so we wanted to make sure that there was, recognition that their story mattered. And so as you can see, the majority of participants came from Ontario, which is, in all fairness, the majority of the population in Canada is Ontario. There was weaker representation out west. And we can't really explain why, but we knew that was maybe an asterisk in the data. And many communities ask us for their community-specific data. And even though there were more than 1,300 or almost 1,400 participants who completed the survey, it's really hard to get down to the really aggregate data, community by community. So if that question is burning inside you right now, that's the answer, is that it's really hard to get down to community by community data, especially if the numbers aren't there. But it's important to recognize in a national picture what the story is unfolding like. And so as Mary Jane mentioned, Away Home Canada and the Canadian Observatory on Homelessness played a really important role in sort of stewarding and supporting organizations throughout this process. So they had about a 4-month window where they can complete surveys. And so we were engaged with youth serving organizations on an ongoing basis. We did sort of tutorials and provided them with tips and steps. And so it was really coaching along the way, so they didn't feel alone or isolated. And, and many times they struggled with the questions. And so we'd have to work with them about ways to maybe ask the question differently and get the same answer.
David, before you go on to that next slide, I have a question in the Q&A that goes back. Why is Prince Edward Island not on that list?
Because they didn't participate.
Okay.
There weren't any survey respondents from PEI.
Okay.
Yeah. So we engaged. We've got partners in PEI, but they just weren't successful in getting young people to complete the survey.
Okay. Thank you.
Yeah. And so in the 2019 data, it was important also to recognize that we had to adapt some of our questions to reflect the uniqueness of the individual experiences of young people. And so that meant we needed to think differently about how we were asking specific questions with respect to gender, specific questions with respect to sexuality. But overall, the age of experience and the survey respondents in the 2016 and 2019 data stayed roughly the same, in that the average age of participants was about 20 years old. Shockingly, we had more younger people complete the survey, so 13 and 14-year-olds complete the survey, which is a bit scary. And some of the work that we've been doing within the COVID-19 context, and we support a weekly real-time practice call with practitioners across Canada. And shockingly as well, they're seeing more and more young people show up at their door for services in the midst of COVID-19. And so we're hoping this is not a trend that we can sort of bend back towards a bit more of the positive, and that we're not seeing these young people show up requiring services. And so it's probably a reflection of, deep family challenges and isolation, but something we certainly want to monitor going forward. We also, knowing that the 2016 report, when we saw the data in its totality, we felt there were gaps as well. And we felt that, given the work that Mary Jane mentioned around TRC and the importance of connection to land and culture, we wanted to be very focused on how we were asking questions, not only for racialized communities, but for Indigenous young people. And so 44.2% of young people said they did not feel connected to their land and their culture. And so this has been a bit of a stepping stone for us as Away Home Canada and the work that we were engaged in with the Canadian Observatory on Homelessness and another national organization called Help Seeker around how we embed culture and land and practice and that specific work into our programmatic and our policy responses for young people, knowing that Indigenous young people are overrepresented in the population. So we knew that we knew that we needed to be really concentrated on this. And so we've got some work happening now that focuses specifically on how we ensure those young people feel more connected to land and culture. And, even more shocking was the 70% data around young people not feeling connected to a specific area of Indigenous land. So whether that be the land they grew up on or the land that their families were still connected to. And so a real lack of connection or disconnection. And Jesse Thistle's Indigenous definition on homelessness really taught us around the differences between Indigenous homelessness and what many would call mainstream homelessness. And it was a disconnection to land and culture. And so how do we embed that in our programmatic and policy responses as part of our priorities at the moment? The racialized reality around the survey respondents was also a highlight for us. And we knew that when you look at the breadth of data and research out there at the moment around youth homelessness, there is a lack of really dedicated research and evidence around racialized responses to youth homelessness. And certainly in Canada, there's more of it in the States, but we wanted to concentrate on that. And so as we roll out the 2019 data to the public, we're actually going to be rolling it out in a number of phases. The 2016 data came with a big report with all of the data, and then it landed on a series of policy briefs and breakout reports. We're sort of flipping it this year, and this year will be a focus on smaller breakout reports and then leading into a larger report. And the first couple of reports will be specifically on racialized young people and Indigenous young people within the data. And so these data points sort of reflect the significance of the important work that we need to be doing with those communities and with maybe unlikely stakeholders in the work. Not all individuals or organizations who work with new immigrants or young people who identify as racialized are connected to the youth homelessness sector, perhaps. And so it suggests that we need to cast our net a bit larger in how we support those organizations, whether that be the faith-based organizations or whether that be organizations that are supporting new immigrants and citizens. But it really, it kind of took us out of our lane with respect to the typical players within the work that we're doing to support not only on the ground responses to youth homelessness, but also the realities around policy and practice responses. And so we know that, so this is convenient. We didn't plan it this way, but we knew that because ASI was focused on adverse childhood experiences, we wanted to bring that layer into this presentation. And we knew that this was an opportunity for us to continue to tell the story and link it back to foundational pieces of research that were embedded in work already. And so the four researchers, so Dr. Stephen Gates, Dr. Caitlin Schwann, Dr. Bill O'Grady, and Dr. Sean Kidd did the work to connect not only data back to adverse childhood experiences, but also correlate some of the realities that young people were facing, and again, draw a closer linkage to ACE in the data. And this will come out in the fulsome report. And so what's shocking when we look at the data is that 57% of the young people surveyed, so of more than almost 1,400, had 5 or more experiences that would directly connect them back to adverse childhood experiences. And so almost 75% of the young people surveyed in the data had at least 3 or more experiences that will connect back to ACEs. And so what's important to draw the connection to is maybe the commonality of adverse childhood experiences. And so I want you to remember these things: 57%, 10%, 9%. So a 75% total of more than 3 experiences. And so of the general population, we're looking at just over 20%. And so this suggests not only the the severity and the risk that young people face when they experience homelessness, but it also suggests also helps tell their story about why they become homeless, and more so why they remain homeless and why they then transition to being chronically homeless adults. And again, this foregrounds the importance of early intervention and prevention, and why we need to get further upstream, why we need to be, in some of the questions yesterday in our facilitated dialogue really sort of shone the light on where we should be placing some of our emphasis, why there was a need for us to think differently about who our stakeholders are in this work, and what is the role of education in this work, and how do we support educators and schools to not just be places of learning, but be a place where we can support young people who may find themselves at risk of a number of things. And so this has become sort of an opportunity for us to, again, as we always do, try to change the dialogue and the conversation around this issue. But again, it brings in this new lens of ACEs into our work, which has been a really important next step. Back over to MJ.
Great, thank you. That was great. I actually learned something there I didn't know. So a few things actually.
All right.
David has actually worked on this study, and I have not had so much contact with it, so it's been really helpful for me too. So I'm going to kind of have a conversation, or we'll start the conversation around the practice and policy impacts and pathways. So really, we just want to kind of focus in on what changed for us, what happened in our work, and some of the things that came out of it. So how the data has shaped other pieces of work, and ultimately our shift from crisis response to preventing youth homelessness. Key findings from both the Without a Home studies point to things we need to do differently. Prevention, shortening that time young people are exposed to homelessness, are two of them. We are doing this by addressing it through again, as I said, transformations in areas of policy, in planning, practice, and innovation, which is all, and now it's evidence-led because we have this beautiful data that we're continuing to build. So the Without a Home story was one important tool for our collective toolbox, and we need many tools, but this was a critical one, both of the studies. We developed a series of policy recommendations after the first Without a Home study for our collective advocacy with various levels of government. And then during the renewal of the Reaching Home federal homelessness funding, we did have data to focus the spotlight on prevention and youth, which had been previously missing. So of course, there's much work to be done on that in that regard, but now there is a focus on prevention and thinking upstream, and youth are included as well. So that's really critical.
Let me just jump in one sec.
Yeah, for sure.
Sorry, we might do this a couple of times, folks, so bear with us. Important also around the new Reaching Home strategy is that and it wasn't because of us, but we'd like to say we played a role in it. Yeah. So there is new directives within the Reaching Home, Canada's homelessness strategy, around preventing inflows into homelessness. And so that was a real victory for us. So it may not have been our language, it may not have been what we said, but we felt we contributed to it because of the importance of not only this data, but what the federal government was finding out about the national point in time count numbers around first experience of homelessness. And so I think that's an important next step in sort of this maybe more conceptual shift around prevention nationally, and certainly being endorsed by the federal government is really important.
Thank you. So we're not just doing this research for research's sake. Our whole purpose is to gather this evidence to shape our solutions and influence policy and practice. So one of the things, an important piece that came out of this is the roadmap for the prevention of youth homelessness. And this was a real game changer in our ability to shift not only our thinking, but the thinking of the sector and all the systems that we work with. It identified for the first time what youth homelessness prevention actually is and what it isn't. It helped us to develop a typology of prevention, and it did that important definitional work. You can access this resource on our website, but I have attached it to the session as well. I think that's all I wanted to. I'm hoping we can have more of a discussion about the roadmap in the Q&A. So I think that's good. Right. So the roadmap led to the development of program models that really started to target the various points on that continuum of potential prevention services. All of this work is being supported by our Making the Shift Social Innovation Lab, Youth Homelessness Social Innovation Lab. And we can talk a little bit more about that in the conversation as well, which is funded by the federal government. But this is an example of some of the program models that we're in the process of developing to address youth homelessness upstream. And you can see there's a range there. So starting on the far left, the duty to assist is a policy and legislative approach. It's very successful in Wales, and we're prototyping that with young people and stakeholders in Hamilton. We have another session yesterday with our colleagues that went into that in more depth. And we can discuss that. There'll be a recording of that session. We're also working on Upstream Canada and Youth Reconnect, which are specific program models addressing prevention in schools and adapted from models in Australia and the Raft in Niagara. Housing First for Youth on the closer to the downstream is our most robust program model, and we are with community exploring adaptations currently for both youth leaving care and Indigenous young people. I think for now, the critical piece is that all of this is supported or through family and natural supports. And I heard quite a bit across the conference around the focus of family and not sort of separating youth out from their families. And we've had this critical lens and have been applying it for a while. We started out with testing it as a program itself, but we realized it's the lens, it's the way this work cuts across our program areas, it's the way we need to work. And then the other piece, of course, is really ensuring that there's equity, diversity, inclusion across all of that. All of this is evidence-led and demonstrated as opposed to piloted in communities across Ontario, BC. And so what I mean by that is that the work is iterative. It's rigorous research supports are wrapped around each of the program models. And there's a process to take the learnings and then turn them back out to community. We're starting to use the human design principles, and it's a deeply community-led engagement at the center of the process, including Indigenous-led and systems focus. So whereas with pilots, you would wait till the end to evaluate effectiveness after a year or whatever, we're committed to sharing our program innovations as we go, so communities everywhere can start to begin to implement rather than waiting for that final product. So we're hoping that'll, because one of the things we always ran into a problem with scaling. How do we take something that's working really, really well in one part of the country and share it broadly and really shift that, make that whole shift? And so we're doing this through these demonstration sites. These program models began to engage public systems differently as well, which I think David will discuss in the next slide, but we're really about systems focus. So.
Yeah. So I want to, before I jump on to the next slide, I want to touch on one thing. We've got this language that's out there, and just to clear up any confusion. So we have now, I'm glad I'm on camera because when I talk, I use my hands. So we've got the Making the Shift Youth Homelessness Social Innovation Lab, which is a 5-year federally funded national center of excellence that is focused on filling the buckets of research where there were gaps in the research. So it was important to share. It's the first social-based NCE that's ever been funded through the National Center of Excellence. So $18 million over the next 5 years just to do youth homelessness research. So that's the big umbrella. Underneath that umbrella is the Making the Shift Youth Homelessness Demonstration Labs, which Mary Jane just spoke to, which is the practice and program responses. So testing practice and program responses on the ground with young people. And again, continuous improvement, very focused research and evaluation, but also very focused sharing of knowledge. And that the At-Home Chez Soi project, which people are probably familiar with around the research that happened around home housing first. It started and it ended, and the research was available. There was no learnings along the way for all those people who were waiting and wanting to do the same work. And so we know that the work is happening really quickly. And so with not only the Inc., the Making the Shift Youth Homelessness Innovation Lab, and the Making the Shift demonstration projects, we're going to be pushing out research and evidence and learnings along the way. Again, continue to accelerate the work that happens in communities. And so as we think about our continuum, it's really important for us to think about then who fits within our continuum. And I come from this work from a policy perspective. I was if you've read my bio, I was with the Alberta government for a number of years, played a really unique role across a number of different portfolios in that time, and always had a focus and a lens on public policy or social policy focusing on high-risk youth. And took on the role of supporting Alberta's response to youth homelessness. And I can't tell you how important this data would have been had I had it when I was mired in cabinet policy processes around new dollars and policy shifts for the province of Alberta. And so as we look at our continuum, the same continuum that we were looking at for program models, we need to then start mapping on who across government could fit within our same continuum. And so within early intervention, we know that there's a role for K-12 education, and not the educators, but how do we support educators in the schools, and again, to become not just a place of learning, that hub model, that safe place for individuals. We need to be thinking differently about how we respond in the child intervention context, or health through addictions and mental health supports, or on the income support side, much of the work, and we did this project, speaking of Wales, speaking of duty to assist, this is how we sort of unpeeled the onion around duty to assist. We were engaged in a research project for the Wales Center for Public Policy. And so we did an international evidence scan on prevention. And some of the most compelling evidence internationally around prevention come from this place around income supports and also evictions prevention. And so what in the early intervention window can we be doing to ensure individuals can remain housed, stay housed, not deal with disruption because of moving, those kinds of things. And again, I don't need to go because it's all there for you, but we have a much better ability to have these really concentrated and focused conversations with government about where do you fit within the response to youth homelessness. Because in many ways, and this is the conversation that I had around my cross ministry tables when I was with the Alberta government, was education came to the table and said, well, I don't know if we really have a role in youth homelessness prevention. It's like, and so now this data, and the 2016 data is really interesting, and we sort of glossed over it, and we did more so because we knew there was a lot of content to cover, but there's data within that 2016 survey that speaks to the number of individuals who experienced bullying in school, the number of individuals who were diagnosed with a learning disability in school. Those two data points should speak to the ability for schools to have a better sense of who may be at risk of homelessness, just those two. And so that then we can then build around that to think differently about these program responses like Youth Reconnect and Upstream work that's happening in schools to be able to better support schools to ensure that young people not only remain in school, but remain in school in a really productive and healthy manner. And so, we continue to emphasize the importance of the 2016 survey and the 2019 survey, but it really has kind of streamlined and accelerated the conversations we need to be having around the policy domains and who needs to be engaged. And so, what are our conclusions? What have we landed on? And across a number of different streams of activity, the work that we're doing with young people with lived experience, we've learned that first and foremost, we're waiting way too long to intervene and assist with young people who are experiencing homelessness. There is no threshold for how victimized or how embedded or how ingrained in the homelessness population they need to be before we respond. We just need to be responding quicker. And we've heard that from community organizations, we've heard that from young people, and we've heard that from government. We need to do a better job of intervening quicker so that young people don't fall into those experiences that are really, really scary. And secondly, the length of time young people are finding themselves homeless has devastating health, safety, mental health, and traumatic experiences for them. And so those then make it harder and harder for young people to wind back and exit that homeless experience. We know that, again, long periods of homelessness mean ongoing discrimination, victimization, violence, substance abuse, those kinds of things. We know also, fourth, that a crisis response to youth homelessness is an effective or inadequate solution. We know that this maybe is no surprise, and maybe it shouldn't be fourth. We know that sheltering young people will not end youth homelessness. We know that large-scale policy change and policy shifts will be the root of how we respond to youth homelessness. And so, to this point, we're doing some really interesting work right now with the Child Welfare League of Canada. And so we were engaged with them and have been engaged with them since the pandemic began around ceasing transitions from child intervention. So there is, in most provinces, there is a moratorium on young people transitioning from child intervention. And we knew that in a pandemic, young people should not be transitioning. So this is a moment for us to work with governments across Canada to rethink what policy and practice responses should look like around transitions. And so that we aren't falling into this crisis response when a young person transitions out of child intervention, does okay for a bit, and then falls into precarity and risk and crisis, and then we pick them back up out of that. And so we need to sort of mesh these two systems together, child intervention and housing stability, and so that we aren't dealing with a crisis response. And further to that, we know that public systems are failing. We know that they are not doing what they need to be doing to transition, to not only support young people to transition from those systems, but we know that they're not doing everything they can be doing to prevent young people from entering into homelessness. And moreover, and these aren't sequential, but these are really key points, is that young people with lived experience profess the need for a shift from crisis to prevention. We did this really important conversation with young people across Canada, and we asked them, what would it have taken to have ended or prevented their homeless experience from happening? And young people could have zeroed in on the moment they felt at risk, and they could identify if an intervention had been available to them at that moment, they would not have experienced homelessness. So that was a really powerful moment for us in thinking about, man, if young people can wind it back. And so we know the solutions exist. We need the policy permission and the practice, the program permission to be able to embed those things in our work. And so this sort of dovetails and sort of shapes sort of where we're going. And so I hope you can see my cursor. So historically, and for years, for the last 30 years, we've been relying on this crisis intervention response to respond to the issue of youth homelessness. And that can be youth shelters, that can be emergency rooms, that can be oftentimes justice involvement. And so there's been lots of emphasis placed on crisis. And even in the adult system, there's lots of emphasis placed on sheltering. what we were moving from is not changing the crisis response, but elevating how we prevent and how we ensure sustainable exits happen for young people. And so these are the domains that we're focused on, while we also want to refine the crisis work that we're speaking to. And that can speak to shelter diversion, that can speak to different models of housing that can support sheltering. But this is an important place for us to be thinking about moving away from this really heavy focus on a sheltered response to moving to prevention and sustainable exits. And so really, what does that mean? What do we need to change? From an emergency response, we're looking to move towards preventing and sustaining exits from homelessness. We're moving from a system response to a systems response, as I illustrated in our continuum. The need for multiple system players to be at the table, working to solve the issue of youth homelessness, not only at the community level, but at the individual level. And we also need to be moving from an eligibility-based criteria for services to a rights-based criteria for services. Is that it?
Yeah.
That's it.
That's it.
We should have like a thank you slide at the end.
Yeah. Thank you.
The list. And Samantha has asked, when is the current 5-year period ending?
Current 5-year period for the National Center of Excellence, the Making the Shift Youth Homelessness.
Yes, Making the Shift, yeah.
So it just began. So we just finished year 1.
Okay. And Christine has asked, do you have advice for housing for rural remote youth?
Yeah, we have lots of advice actually, and there's lots happening right now around the rural and remote response. There's actually a national, I guess it's considered an organization, that is focusing on really elevating the conversation around rural and remote responses to youth homelessness and homelessness in general. But we're seeing lots of innovation coming out of the rural and remote youth space around not only housing solutions, so lots of rural and remote communities are getting into the idea of host homes, so they probably don't have the bandwidth or the capacity to support a shelter to support that crisis response. But many of those communities are moving into a host homes model, which is kind of like a foster care model where a family would be deemed eligible and supported to support a young person in place in their home to stabilize, and then that organization would also work with the family to stabilize the family and then potentially reunite them. We're also seeing lots of work happening within like the hub model around co-location of services and then sort of identification of the broad scale of needs for young people. And so those are a couple of hot button ones, but Christine, if you reach out to us, we can get you some more content. And then Mary Jane, if you have anything to add.
I was just going to say that the National Alliance to End Rural and Remote Homelessness is the folks who are doing this work right now, and really their big focus too is the gap in data, right, around rural and remote young people. And so they're trying to, and they are effectively mobilizing data and trying to, again, take that story and tell that story to government. What the issue there is that rural and remote areas often get skipped over because we aren't measuring things. We're not talking about it in that way. So they're really focused on that, and I'm sure we're really happy to have you join us there.
Let me see. Lisa commented, love the focus on cultural and contextual fit in different communities, and asked, how are you tracking and sharing these adaptations? Is there a community of practice for communities to learn from each other?
Man, it's like I planted that question. So yeah, there's a series of community practices that are happening right now. So the one specific to the COVID-19 response. So we've got real-time practice calls. And we'll share all these links afterwards. So we've got real-time practice calls that are happening with practitioners across Canada around sort of, again, those real-time changes that are happening for them at the community level around the COVID-19 response. We also have a community of practice attached to the Making the Shift Youth Homelessness demonstration projects. And we've got two, actually. We've got a community of practice around family and natural supports and Youth Reconnect, and we've got a community of practice around Housing First for Youth. And so both of those originally were developed for just Making the Shift Youth Homelessness demonstration lab demonstration sites. But we learned quickly that we needed to expand the knowledge and the sharing on those. And so those are open to people who are interested in learning more about those two practice model adaptations. And so we can get you that link as well. And it's you can, if you're interested, you can sign up. But then there's also this larger sort of piece of work that's happening around Way Home Canada's kind of responsibility of supporting broader community of practices. And so that's sort of coming. And so, if you're interested in staying on top of what that looks like, please send us a note.
I actually have quite a number of really pointed questions. I'm hoping maybe I can get some responses to, and some concerns. I used to live in Winnipeg, Manitoba. And I had direct contact with many friends in my youth that were homeless. Mm-hmm. So I'm really disappointed, actually, that the federal government is spending $18 million doing more research we already know the issues. And I don't think the government should be wasting $18 million when we can be putting that towards fixing the issues. We don't need more, yes, we need evidence, but the people are the evidence. Homelessness isn't new. This is created by our system structure in Canada. So, and now to be spending $18 million when we're already aware of the issues. I'd like a response as to why this money is being spent this way and not going directly on the ground to house these people.
Mm-hmm. Yeah, I think it's a fair question. And from a policy perspective, I'll answer this from a policy perspective. What you need to be able to invest in practice and program responses is evidence. And I can say that wholeheartedly. And so 5 years of funding to support.
So are you telling me there's no evidence of homelessness across Canada before now?
No, I'm not.
Why not?
What I'm saying is there's important gaps in our knowledge around not only the realities of certain responses to youth homelessness, but the realities around the data picture, realities around systems responses, the realities around specific interventions that are required for Indigenous and racialized young people that we need to better understand in order for us to feel really confidently to be able to advocate to the federal government or the provincial government or a territorial government or a municipal government around the importance of investing in these issues. And so I'm the first one to admit that from a policy perspective, there wasn't enough evidence and there hasn't been enough evidence around prevention. And so this is why we're really focused on deepening that knowledge base around prevention and why it matters and why it should matter to the federal government.
Well, I mean, I was seeing all of this across Canada. I was born in 1981. We're talking a long time ago. That's over 30 years we haven't been doing this. So my concern is, we're well aware of what's caused the homelessness. It's something the government's been well aware of. So I feel like this is just dragging the process longer. We have people that need this assistance now. They can't wait for an innovation lab to do 4 more years of research.
Samantha, your question is a good one. And you know who the best person to ask that question to is your MP, not us.
Well, he already spoke about mental health in a discriminatory fashion in this forum, so I'm not sure that's the right place to go. And the other thing, we talked about over 85% have issues with mental health illness. I would argue that also applies to the adult homeless population. I'm sure the research has already been publicly made available. So what have you spoken to about the role of lack of those access to services? Has that not perhaps caused homelessness to some degree?
The lack of access to mental health and addiction supports.
Correct.
Yeah. Oh yeah. We continue to beat that drum, and we continue to push that gap in programmatic and policy responses on an ongoing basis. And much like we continue to beat the drum around a lack of response around effective transitions for young people leaving child intervention. These are large scale boulders that I feel like we push uphill, and you're not alone.
I'd argue the resources are already on the ground. Anyways, and then the other question I have is, have we looked at this from more of a sociological perspective and a holistic community family health system? Because I've been homeless myself. I've known people that are homeless, and I hear the same story over and over again, and nobody's talking about it. It's people feeling alienation. That's clearly what it is. And we are not talking about it in public and professional research that I've seen recently. It's clearly there. It's obvious. People are alienated from their community, from their families. They don't feel they have the access to resources, that nobody wants them. It's basically poverty discrimination systemically. There's no place in the community for people that are poor or that have mental health issues. So they're alienated from our communities, and we've caused this. So I'd like that added to the research and addressed.
Yeah, no, I think equity and the response around those kinds of things needs to be addressed. If you get the chance to read the roadmap for the prevention of youth homelessness, and maybe take it in small bites because it's a monster, it speaks to many of those things and the system failures that have happened, and where we need to place more of an emphasis on that holistic family response, especially in the early intervention phases of this work around, housing stabilization and rent controls and access to housing and all those things that do come from a privileged place and should be rights-based normal.
Well, it's just, this goes back to my comments about this duty to assist. Like, we already have the Charter of Rights and Freedoms. Like, I don't understand why we're doing all of this. I'm sorry, I really don't. The evidence is already there. The resources are already in the community. So why do we need to keep talking about this for 4 more years? I'm sorry, I just don't understand. Why can we not be starting action in the communities now?
Well, and I think that's where the community struggle is, that they've tried and they've worked to create local responses, and they run up against maybe ceilings to which they're able to function within a funding atmosphere or a permission policy atmosphere or a programmatic atmosphere that don't allow them to get to that next step. And
why are we not talking about the Ontario class action litigation to try and protect the homeless people there? We need to be looking at those legal arguments. There's a reason lawyers are bringing class action litigation for the homeless in Ontario. Should that not be a part of this forum and this discussion?
You mean this presentation or ASI?
The whole forum. Like, we have people that have just engaged in class action litigation in Ontario and Toronto to protect the rights of the homeless and to provide them shelter immediately. Like, this is going to the courts in Ontario. There's injunctions. Why is that not part of this larger community discussion? That's very important information.
Yeah, it is. No, it is. I mean, and it a number of our national partners are engaged in all of that work and supporting all of that work. And so, I mean, these are all, I learned long ago that within policy change, there are very few to no home runs in policy change, but there are a lot of base hits. And so all of these things, we'll get to home base, but we need to get there sequentially. And we won't get there in one.
I don't want to live in a Canada where we have to wait for court action to try and protect people's charter rights, and we have to have a court say that charter rights have been breached. We have an obligation to do this now. I don't want to be seeing court action about this.
Samantha, we're on the same page. We are on the exact same page. These are government questions. These aren't away home questions, because we're doing everything we can to support this response. And so I encourage you, you're passionate, and I encourage you to.
Well, do we not have political and government people? Like, I feel like nobody's speaking freely in any of these sessions and forums. It's just basically lectures, and it's like, we can all figure that stuff out. We already know that. Let's have an actual discussion.
Mm-hmm. I agree.
So,
are there more questions, Wendy?
Yeah, I was just wondering, Samantha was just asking for a discussion. If anyone else would like to raise their hand and ask questions or make comments, let's share the air.
I would like to jump in for a quick second. I'm Julia, I'm from Newfoundland. In St. John's, we have this great organization, I don't know if you're familiar with, called Gathering Place, and they support, local citizens who, they may be experiencing homelessness, they may not, they may be experiencing poverty, mental health issues, you name it. It's basically just exactly what it says, a gathering place for everyone in the community to go, whether they need healthcare services, they need food, they need recreation. It's a great resource, and I'm very proud to say that that's a part of my community. I'm just wondering if Away Home reaches out to local organizations such as that and shares, what their research has found, suggestions for how these organizations can, support policy change in that kind of way. So I'm just interested to hear how, I guess, a national organization helps to, create local and maybe even provincial change. Just wondering if you guys do any of that. I'm sure you do.
Yeah, we try to. We're Away Home small, like we're 7 people, but we have a really actually strong, I would consider them a national partner in St. John's called Choices for Youth. And we've been engaged with Choices for Youth for a very long time, 15 years. And so I use that example because we somewhat rely on those organizations who are engaged with Away Home Canada on a regular basis to sort of be that conduit and reach out to communities that are within their community. And so we've done lots of work in St. John's. We've actually been engaged in St. John's in a number of different ways. We worked with Choices for Youth, who was advocating for a provincial plan to end homelessness. We've worked with Choices for Youth on their provincial expansion, in that they look to expand other communities outside of St. John's. And to your point specifically is that we're actually working towards a new training and technical assistance program within Away Home Canada to support kind of what you're saying, is that on the ground, real time change management opportunity that happens for organizations who are maybe struggling with how to maybe shift to prevention, struggling to influence funders around a new opportunity, struggling with a practice model and how to implement it. And so we're sort of kind of like doubling down on what that means for communities, because we continue to hear that same question, is that we're a community, we want to change, we have a challenge, we have an issue, we don't know how to proceed. And so that's sort of coming. That's like, that's the preview. And so there's more coming on that. But yeah, Julie, if you have specific questions, we can certainly fill you with resources and content, and also connect you with organizations. And that's another sort of strong component of our work, is that we're a conduit towards other organizations who are doing like-minded work and that you may not be connected to. And so oftentimes that's maybe the best learnings possible. Mary Jane, anything
That's
else?
awesome. Thank you very much, David.
I have another, oh, sorry, Mary Jane, go ahead. And then I have a question from Huva.
That we are currently working with choices on, and I really skipped over the piece around the Upstream and Youth Reconnect program models, but they are really about working with the education system, because as David pointed out earlier, that's where the key place and where young people have told us start there in terms of intervention. But we are working with choices right now on a pretty on the Upstream Canada model. They're demonstrating that model with the St. John's School Board. So there will be, I think you'll see more of that developing, but that is a deeply like a systems-based early intervention prevention, where we will work with the school to assess risk for the school in middle school. I think what's really important about that is it really is, a partnership from national to local, and should have a bigger impact on the overall population in St. John. But that'll be something I think that you'll hear more about, and we'll locally, and you'll be able to latch onto that and connect and work with them. Just one example. There have been others as well that through choices, but we're really eager to really work more closely. And thank you about the gathering place. It's an awesome.
Yes, and choices is great too. I just have more experience with the gathering place, so that just came off the top of my head. But I know that choices, like you said, it is expanding across the province, which is fantastic. I was discussing with another delegate recently about how a lot of the mental health services, and I'm sure services for people who are experiencing homelessness and poverty, are very, very urbanly centered. There's not a whole lot rurally. But anyways, thank you guys so much for addressing that.
And just so you know, Julie, I think Mary Jane added our website link into the background content for this presentation. And so there's a resources page there, which I encourage you to go to.
Perfect. Thank you so much.
Yeah, thanks, Julie.
Excellent. Now from Huva, Lisa has asked a really interesting question. You mentioned the use of storytelling. Can you comment on how you're using method for communicating with different audiences, including practitioners and policymakers?
You want to take that one, Mary Jane?
Sure. Yeah. So I think, what I was referring to in terms of Without a Home is it helps us change the meta story. So the big story around youth homelessness, from that, they're the young people are the problem, and they should just, pull themselves up by the bootstraps and do their dishes and smarten up and not run away, and all those sorts of things that were really out there around young people. So having all of these data points, that we've gone into, really helps tell the story, and now with the ACEs as well, really helps tell that story that, this isn't about a young person just not pulling it up. It really is about all of those structural and systemic impacts on their lives, and this is why it's increasing as well. So there's that story. Having said that, we're also starting to get to use more specific narratives to help to move things forward. So some of the work that we do, we are actually collecting stories from communities around, for example, COVID. What were things that worked in COVID? What didn't? Because there's a lot of innovation happening around the country that we're trying to capture and tell those stories, and then share them with the country, with our communities. We're doing that in the next report that will be out is a COVID-19 survey report that went into what was happening with service providers during COVID-19. In that is interspersed actual narrative stories around between the data that tell the impacts. And there's some incredible innovation and some interesting things that happen once we pulled that lid off of like how COVID pulled the lid off. So those are some experiments there. We're also developing a whole storytelling team that's actually going to take this further and talk about how we can actually grab those stories from the community and really share them outwards. But we're totally open to ideas if you want to share with us and create and help us do that, because I think it's the local, it's changing that meta narrative, but it's also in our mental models, but it's also really giving examples of hope. Something I hear about quite a bit when I'm outside of homelessness and talking to friends and colleagues and neighbors is folks, I don't think know what's really some of the great things that are going on and some of the good stories that are happening and some of the good work. We hear the issues and the problems, but there are solutions. And I think getting back to some of the earlier comments, what we're really trying to understand is we do understand the situation, but what's happening with solutions and how can we share that out? So those are some examples. And I think we need to build that out further. It's something that we really started to focus on this year. So David, did you have anything else you wanted to add?
Yeah, no, I think you got it all.
Okay. Thank you. Well, more to come on the storytelling piece.
Paige has asked a question in our session chat. She said this may have been answered, but I'm not sure. Within the data we've looked at provincial data, is that the only data that is available, or is there something, or is there more specific? For example, she's from Cape Breton. Is there anything specifically from there for more rural places in Nova Scotia?
Yeah, I mean, I made the point earlier around the aggregate data that came out of the Without a Home surveys, and that we not being able to drill down specifically into specific communities because the data wasn't comprehensive enough for a community if there's 5 or 10 responses. So I wouldn't say from the Without a Home data there'd be good data to draw from, but the federal government does release like a data report card every year, which you may be able to dig into that data and drill down far enough to local, provincial, and community realities around, it'll be homelessness in general. That's the only maybe light that went on for me around other data sources. Mary Jane?
Yeah, I don't think so either. I'm wondering, no, I'm not coming up with anything, but I'm also wondering now, the way if the process that we've engaged in from the earlier Without a Home to the later, and all of the adaptations that David talked about interest you, then some of the questions that we ask might be really helpful for local work. So thinking about some of the ways that we're approaching data, and we didn't really touch on like the decolonization of data and the equity diversity piece. All of those pieces we've been learning carefully about how to do this differently and better. And we're happy to share with you some of those pieces if you want to engage your own community and your own province around changing, or if that's helpful for you to really pick up some of that. And then what we'll get to is more correlation across those as well. So like I think I mentioned at the beginning, before Without a Home, there wasn't really a pan-Canadian, but loads of communities were doing their own surveys. And so having correlation across those different data sets is really, really helpful as well. So, and it'll help you look for what you need to know. So.
There's another question in Whova. I'm just scrolling to it here. I just lost it as soon as I lifted my eyes from the computer. What is the role that a lack of proper and timely mental services had for youth? Was the trauma ever treated in these youth?
I mean, it's kind of, there's an asterisk on this answer, and Mary Jane may be able to build on it. So part of the challenge, if there is a challenge with the Way Home, is that we aren't so deeply connected to the organizations in the programmatic response to understand the layers to which they're responding to young people and sort of how they close the loop with young people. We do know that organizations have now, and many of them have shifted to a trauma-informed response, and that practice model to focus on addressing trauma in the same way that they're addressing stabilization. And so we know that it's an evolving sort of practice model within our work, and something that we're watching closely within our Making the Shift demonstration projects about how we're responding to trauma, especially around the Housing First for Youth demonstration projects. And so I think there's probably more to come in some of those realities and how they are addressing trauma. But yeah, I think it's one of those places, again, this gap in knowledge that we have around the how. You know, we know a lot about the what now. It's the how that continues to be the gap. And it's the how that often becomes the policy permission for governments to fund things. It's not the what. Governments know. Governments know young people find themselves homeless. Young people know that being homeless is a risk factor. But the how is what we need to focus on. And so that's sort of coming up for everybody. Right, Jane?
Yeah, I was just going to emphasize, so some of the program models that we're demonstrating as opposed to piloting, and maybe just to restate this, that's where the research is happening, where we're supporting those communities. They develop the models and they have permission to iterate and get something wrong, and then but we're there to like support that and help create the resources that are needed for the rest of Canada to actually duplicate or replicate those models. So that's, I think, a really key element. I just think that's really important in terms of the mental health as well, like how mental health is impacted at that granular level and how it's responded to. Yes, we have the big studies that tell us what's happening, but we're now just able to get at the actual activities and the behaviors and the relationships. That's a big one. What are the relationships needed at the programmatic or the local level, at the organizational level, between workers and young people? How do they change the way young people can get their mental health outcomes? So those are some of the things being teased out of the demonstration sites, and so why we're excited about the research that's happening there. The Big Without a Home studies are amazing because they give you this big pan perspective, but it's the work that we're digging into as young people are being supported. It's also worth noting that there are, I think, David, and you'll know the number, how many young people are being housed within the Housing First for Youth model. Like, there's a number. So it's not like we're researching and they're not being supported. Those young people are being provided with family and natural supports, Youth Reconnect, Housing First for Youth. The research is around it, but the focus is how can we support those young people at work, and mental health is a key part of that. So.
Yeah, that over the 2-year project, that demonstration project, the goal was to work with 1,700 youth and families, and I believe they've surpassed that number.
I believe so too. Yeah, it's been critical, and like the feedback that we've got from communities is essential. Like, these young people are being stabilized and thriving, and they aren't cycling in and out of emergency shelters. They're not sleeping in encampments. They're actually getting education. They're employment, reconnecting back to their families. So that may be something we kind of skipped over a little bit quickly there, but that is the core of this work. The research is the outer piece that supports it. But this is where we're really, really making a difference. And I throw all of the credit to the community partners that we work with across the country who are doing incredible work, and was made even more incredible with the COVID situation, where a lot of their supports were cut off, and really perform miracles. So that's where we want to focus our energy too, is how to elevate and spotlight that community work that's really making a difference. And then how do we get that across the country and support and actually end youth homelessness? So that's something I don't think I said today either, which I meant to, is a few years ago, you couldn't talk about ending homelessness, really. People would say, that's not possible. But we now actually say we are going to end it, and we will end youth homelessness. So that's pretty...
Yeah, Mary Jane brings up a good point. Because we're at the place, we, Away Home Canada and the Canadian Observatory, where we're seeing the research and the evidence and program model guides and the content around the Making the Shift demonstration projects, you almost need to like remind yourself, it's like, holy yeah, I almost swore right there. Holy yeah. We're saving kids' lives at the same time, and we're changing families, and we're keeping families together. We being the demonstration project partners. So it's like, it is a really important marriage in the work around evidence, is that, yeah, this work is happening on the ground and it's magic. And what we're yielding from it is this permission for communities to do the same.
And permission for government to fund it across the country. So the government.
That too.
I have one question. Is there work being done to address political and bureaucratic and community stigma towards those that are homeless and mental health issues? Because I think that's really important, because we have to deal with the fact that a lot of these people feel shame, they feel humiliation, they feel they don't have trust in their government services or their community services, that they don't get the support they've asked for, so they give up. And then we also have stigma that some people are out on the street pretending to be homeless, and they really have a house and they're getting social assistance, so they're just going out to make extra money. Like, these are even things I hear from people in community organizations and PEI. I hear such discriminatory language used.
Yeah, I do too.
Yeah,
About
I mean,
that
part of the
like I think we really need to address, there is huge stigma and discrimination against people that are homeless, or why they're homeless, or everything. Like, what talk are you doing about like the structures? Like, it's capitalism that's created all of these structures that discriminate against people. So all of this policy talk really isn't going to do too much if we have decision makers that are discriminatory.
You're right. Yeah, and I think, that's also a layer to which we use the research and the evidence, and then a way to sort of like strip back some of that stigma and to cast maybe a brighter light on who these young people are. To Mary Jane's point, they are young people who just have refused to do the dishes and not go to bed on time. These are young people who are multi-barriered, who have experienced trauma themselves, who have left an unsafe situation.
We have to get rid of a discussion that people choose to be homeless.
Exactly.
We really do.
Exactly.
That is a huge misconception, that people choose to be homeless.
Well, and it's the challenge, and I know we're running up against our time here, but a really significant challenge for us is navigating and prioritizing the conversation across the political actors, which oftentimes change, and they change way too often. And so the role as an organization who educates is that we have to continue to educate. You have to continue to influence. And fortunately, we have relationships both on the bureaucratic side and the elected official side. And so as we continue to educate on both, we're hoping that we continue to make some inroads. And again, our education around prevention suggests that we are making efforts and strides. And so it's a continued education process, and a continued process around sort of revealing the realities of this work. And I hear you. You can't do anything if discriminatory policy and rights-based policy isn't a priority.
We're at our 5-minute warning mark.
This has been fun.
It's been absolutely fantastic. The chat in Zoom has been quite busy, and I've been busy copying and pasting the chat over into Whova so it will remain as a living entity for other folks who are listening to the recording and want to access some of these great resources and to maybe follow up on some of those ideas.
I just want to also say I am very critical, but I am just very passionate, and I just want to say thank you all for your wonderful, wonderful work. I know, but I guess my perspective is, yeah, we shouldn't be having to do all this work for this many years. But anyways, thank you so much for the discussion.
Thank you, Samantha.
You can hold us accountable, Samantha. The second report that Mary Jane spoke to, the COVID-19 survey report that's coming out, really speaks to isolation and the challenges that not only organizations are facing with that, but also young people. So it's a significant concern for us. You don't realize the importance of the face-to-face work in this work until it's stripped away from you. And so we share your concerns, Christine, and I can tell you that through our storytelling work and through the innovation work and through the work that we're doing with community partners, it's sort of on the top of the priority list around how do we address isolation now, especially as things kind of open up, but then the reality that it might be wound back again. So thank you for highlighting that. It's an important sort of closing moment.
Any other questions or comments? Fantastic. And I know that David and Mary Jane will also be taking a peek at the Whova questions and the chat, and perhaps adding and responding more fulsomely in the coming days as well.
Yeah, we will.
Okay, final words, Mary Jane.
Oh, I just wanted to thank everyone for the fantastic conversation, for your time, and I really encourage you to connect with us if you have specific questions or comments. We have a range of things happening in different spaces, as I keep saying, policy, planning, and practice. So a lot of projects, and we're always developing more. So if you're interested in something and you want to connect with us, we're absolutely here for you. If you need resources, I have put the resources link. We have a ton of resources, policy, planning, practice. And the roadmap for the prevention of youth homelessness, I think, is a great place to start. But there are others as well, and you can reach out to me, and I will send you directly to where you need to go.
Yeah.
David, did you have anything else you want to say?
What Mary Jane said.
Okay.
That's all.
Fantastic.
Keep in touch, everyone.
Yeah,
wonderful. Just a one last comment in the chat. Will you be sharing your presentation slides, and where is the resource link?
It'll be in the presentation, kind of like when you go to view the presentation, all the links should be in there, but we'll make sure.
We'll double check, yeah. Yeah, we put some in the session. I think the French one's in there too, I hope.
Yep. Yeah, and the recording for our session will also be posted once we trim the back end and the front end off and compress it so people can download it.